Hi, my name is Tina Alec. I am the nurse coordinator of the Pre-Anesthesia Surgical Services Department. We are the department with which you will come to see prior to your joint surgery here at Mammoth Hospital. Right now I'd like to invite you to listen and enjoy these videos from Britt Kogan, our PA, Carrie Sokol, our occupational therapist, Ariel Duval, one of our physical therapists, as well as Casey Michelle, who's our dietitian.
Welcome to the Total Joint class. My name is Britt Kogan. I'm one of the physician assistants here at the Mammoth Orthopedic Institute, specializing in knee and hip replacements. You're probably watching this video because you're going to have a knee or a hip replaced within the next couple of months. This is just an informational video to get you some more information about having your knee or hip replaced. What is arthritis? Arthritis is the loss of cartilage on the end of bones. We as in medicine have not come up with a way to replace the cartilage on the end of a bone, so we do conservative measures such as anti-inflammatory medications, corticosteroid injections, or activity modification to help reduce your pain. When those modalities have failed, that's when we start talking about having a knee or hip replaced. When having your hip replaced, there are two different components that are involved in having your hip replaced. Your pelvis and your leg bone. All of your arthritis is located in the head of your femur and in the cup on the pelvis. And what we do is we cut out the pelvis to put this component in. It doesn't come out of the video, but so basically with the hip replacement, you have a metal cup with a plastic liner. We then cut off the femoral head where all the arthritis is, and you have a component that goes down into the femur itself. Most times the ball is made out of a ceramic. Certain times you will have to use a metal ball. The stem is made out of titanium. There are two different stems that we use depending on your bone density. You'll get a bone density test in the PASS appointment to give us a better idea what your bone quality is going into surgery. One option for our stem is an ingrowth stem, which means the bone grows into the stem. Another option is a cemented stem. That is the stem we use when your bone quality is not super great. So instead of having sandpaper rub on sandpaper, you now have smooth things that rub on smooth things. This is the plastic model of the knee replacement. The metal is made out of cobalt chrome molybdenum. Most people think that when we talk about having a knee replacement, we just chop off the end of your femur or your thigh bone and chop off the end of your tibia or your shin bone and put a big metal component in. I like to think of it more as a resurfacing. This is the actual component that we use in the resurfacing. Your knee has 4 ligaments, a ligament on the outside, the inside, and 2 that crisscross in the middle called your cruciate ligaments. During the knee replacement, we take out the ACL and the PCL, and those get replaced with a plastic liner. We make a whole bunch of cuts around the end of your thigh bone and around the top of your shin bone and place these metal components in place. If you are either bow-legged or knock-kneed, we use computer navigation to help get your leg back out straight again. You keep the 2 ligaments that are on the outside and the inside of your knee. Those stay the same. This plastic component acts as your ACL and your PCL to give your knee some stability. There are many different sizes to each 3 of these components, and we make sure your knee is stable before we leave the operating room. For knee replacements, people are a little miserable for the first couple weeks after surgery. We're doing a lot of cool new things to help reduce the number of narcotic pain medicines people need to take after surgery, specifically with knee surgery. One of the things we do is this procedure called iovera. It is this procedure, it's done 1 to 2 weeks before surgery, and it freezes your nerves, it doesn't kill them. The procedure itself takes about 45 minutes to do. It's a series of 21 pokes in your skin across your thigh and down the inside of your leg. We numb the skin up with some lidocaine so that you don't feel every poke. But once again, this is done 1 to 2 weeks before surgery. It's called Iovera. It freezes the nerves in your legs, it doesn't kill them, and it takes about 3 or 4 months for the nerves to grow back. That is one way that we have started to help reduce pain after surgery. Another way is the day of surgery, you will get a nerve block in your leg to help reduce pain. They'll also do an epidural injection in your back to help with pain. And during surgery, we use a combination of medicines in the incision to help reduce pain after surgery as well. If you have any questions about the information you've seen, please give me a call at either our Mammoth office at 760-924-4084 or the Bishop office at 760-872-7766. You can also try to reach Tina at the PASS Center by calling the number on your screen. Thanks and have a great day.
Hi, I'm Ariel. I'm one of the physical therapists here at Mammoth Hospital, and today I'm going to talk to you about physical therapy aspects related to your joint replacement surgery. So I'm going to talk to you about your physical therapy experience throughout your surgery. So first, you're going to see physical therapy in the hospital. After your surgery, we're going to come see you in your room. If you are the first surgery of the day, we'll see you late in the day. If you're the later surgery of the day, we may come see you, or you might not be prepared to get up with physical therapy until the next day. You will have at least one session with us, but we can have up to as many as you need before you leave surgery twice a day. So that first session with physical therapy, we're seeing how you feel after anesthesia. If you're comfortable sitting up, we'll sit you up for a couple minutes, make sure you feel okay and that you're not too dizzy or nauseous, because that can happen after surgery. And if you feel good with that, then we're going to stand with a walker. We'll make sure that you can bear weight through your leg without your leg feeling like it's numb still. Sometimes after anesthesia, your leg doesn't have its full muscle strength. So first we'll stand with a walker and make sure you're comfortable with that. If you still feel comfortable there, then we will try some walking. We'll come see you the next morning after surgery. We will try walking again with crutches or a walker. We'll make sure that you're comfortable going up and down stairs if you have stairs in your home. And then you can often be discharged from physical therapy at that point. If you're still not comfortable or we've deemed that you're not safe yet, then we'll come see you again in the afternoon. So in the hospital, you're going to want to use a walker or crutches. First time up, I have everyone use a walker because it's more stable, but that doesn't mean that you have to go home on a walker. The walker that we like people to use is called a front-wheeled walker. So it looks like this. There are wheels on the front and regular legs on the back. You can use a regular walker with 4 standard legs. However, that does exert a little bit more energy in that you have to pick up your walker and move it every time you step, where with the front-wheeled walker, you can slide it. We ask that you don't use the walkers with 4 wheels and the seat in them because they are actually a little bit less safe. The point of the walker is so that I can stand within it and push through my arms to unweight my leg if it's painful. If I have the walker with the 4 wheels and the seat, it's in front of me, and when I push through it, sometimes it wants to pop a wheelie and get away from me. You are allowed to bear as much weight as you want through your leg after surgery unless the doctor indicates otherwise. However, because it will be painful and you won't have your full muscle strength after surgery, you do want to be able to push through your arms to unweight the leg. Crutches are needed to go up and down stairs, and some people, if they're very comfortable with crutches and they've used them in the past, want to go home on crutches. My typical recommendation is go home using mostly the walker and use the crutches only for the stairs in the first week or so. Then your physical therapist will direct you when you can transition to just crutches and then eventually to a cane. You can get the equipment here. However, most insurance companies only cover one piece of equipment, meaning either a walker or crutches. So I recommend, if you don't already have them, get the walker from us and then you can charge that to your insurance and pick up a pair of crutches from a friend or from the local thrift store. Bring them with you and we can help adjust them for you in the hospital. After you go home from the hospital, we will encourage you to participate in outpatient physical therapy. If you have a knee replacement, we need to see you 3 times a week for the first 2 weeks after surgery, and then you drop down to twice a week. Typically, the length of time that you will come to outpatient physical therapy varies from anywhere from 12 to 16 weeks post-op, just depending on how you're progressing and what your personal goals are. If you have a hip surgery, you will come to outpatient physical therapy twice a week. Again, that will vary the length of time you're here depending on your goals and how you're recovering, but typically you don't need quite as much time as the knee surgery and outpatient physical therapy, anywhere from 8 to 12 week post-op. We encourage you to schedule your outpatient physical therapy either with us or with your provider of choice as soon as you find out that you're having surgery. That way we can get you scheduled. We like to see you within 5 days of your surgery. So it's fairly quickly after you go home from the hospital. If you go home and you determine that you're too exhausted or in too much pain to leave your house and come to outpatient physical therapy, home health physical therapy can be arranged. However, it's highly encouraged for you to leave your home and come to outpatient physical therapy as soon as possible. So I'd like to talk a little bit about pain science. Pain is a big part of your pre-surgery process and your post-surgery process. We know that you are probably having a joint replacement because you've been in a lot of pain for many years. That pain, we consider arthritic pain, is going to be gone after surgery. However, you're going to have a different type of pain, a post-surgical pain, but this is different in that it's getting better instead of staying the same or getting worse. Sometimes people are concerned that if they have pain, it means that they're actually doing damage to their joints by exercising or moving. But we want you to know that exercise and movement is very important and that pain doesn't necessarily mean tissue injury. So you can have pain, but it's not causing damage, and it's a good thing to get yourself moving. There are ways that you can help control your pain, so medications that the doctor prescribes is the first, but then we encourage you to get off of those as soon as possible or as soon as the doctor deems appropriate. Icing, compression, elevation, and rest are helpful as well. In terms of compression, you will go home with compression stockings on your legs. That helps prevent swelling and blood clots, but that also decreases the pain. In terms of ice, we encourage you to ice throughout the day. However, you always want to make sure that there's a barrier between your skin and the ice bag because you will have some numbness from your incision, and that can cause frostbite if you have the ice on there for a long period of time. Elevation means propping your joint up higher than your heart, so lying on your back with your legs propped up on some pillows. Dr. Karch primarily performs the anterior hip approach. So if this is the surgery you have, there are a couple precautions that we need to be aware of after surgery. Precautions means movements that you shouldn't be doing to ensure the safety of your new hip joint. If you have any history of very severe low back disease, meaning you've had back surgery, you have a lot of low back pain and stiffness, and Dr. Karch deems that this is relevant to your surgery, these precautions are going to last for the lifetime after surgery. This main motion that you shouldn't be doing is standing with your knees completely straight and bending forward to touch the toes. The reason is that in the rare instances this could occur, your hip could dislocate. So you can bend your knees to get something off the floor, but you don't want to lock your legs and lean forward even just partway to do something in this position. You should be bending your knees. If the doctor deems that you don't have any spinal or low back issues related to this hip surgery, you still should not be bending forward at the waist to touch your toes with your knees straight, but that will only be for 6 weeks. I still encourage you to be cautious after 6 weeks, and for back health, it's always better to bend our knees when we're lowering towards the floor if we can. However, this isn't as strict throughout the lifetime as if you have spinal stiffness. Thank you so much for joining us for this video. I hope it was useful. We wish you luck with your surgery, and if you have any questions, please don't hesitate to reach out to me in the physical therapy department.
Hi, I'm Casey and I'm the dietitian at Mammoth Hospital, and today I'm going to review with you guys the information that for nutrition pre and post recovery for your total joint, whether it's knee or hip. You will get the same information. Every single patient that comes through for total joints is individually assessed by myself, and that assessment is based on your age, past medical history, anything you currently got going on, and what surgery you're going to have. And with that assessment, I assess you for the nutritional supplements that you will be getting prior to surgery. A lot of individuals ask, well, why do I need supplementation? I eat really healthy. Basically, it's because you are preparing yourself for an elective car accident, in a sense, and that elective car accident is your surgery. We need to get you all prepared and amped up for this surgery so that when you have surgery, you are at the best nutritional status you possibly can be for the best recovery outcomes. They have shown with malnutrition that there is higher risk for poor outcomes with surgery. Infection, increased length of stay in the hospital, increased length of recovery time, complications of different sorts from the surgery. So it's really important to try to increase our nutritional status. Also, individuals that tend to be underweight or overweight are higher risk for nutritional complications. Even if you are more on the thinner side, you're at higher risk as well, just maybe because you possibly don't have enough in your diet. So we're trying to get you amped up. The research is pretty solid on these nutritional supplementations that you'll be getting, that they benefit for you for surgery. So when you go to the PASS Center, you will get a bag that looks similar to this. And within the bag, you are going to have 2 cases, typically, of supplements plus a couple bottles. And within that bag, Tina will go over this with you, but there is a sheet that has an explanation of the benefits of the supplement, and on the back side there is your recommendations that I will have assessed for you. The typical is 3 to 5 supplements of the Ensure pre-surgery, which you will see in a carton as such. And this supplementation helps with the protein intake. Some individuals get concerned about the carbohydrates in the supplement. They're complex carbs. So they're not like you eating table sugar or having cake. It's complex carbs that doesn't affect your sugars in the same way. There's also probiotics, there's special amino acids. All that helps within this to help fight inflammation and infection during surgery and post-surgery. You will get a recommendation of 3 to 5 drinks for either 5 to 7 days pre-surgery. If there is no lactose in this product, there is some isolates that come from whey, and so if they do affect your stomachs, just let us know. My contact information is in that joint book, or you can call Tina in the Joint Center and let them know, but most individuals will tolerate it. Only individuals not to take it are type 1 diabetics, but type 2 diabetics can, because it is complex carbohydrates. So you will get the recommendation for pre and post. Make sure you bring your supplements with you the day of surgery so you can have them when you're here in the hospital, and you can start drinking them right away after surgery. You will also get another supplement, just 3 bottles of this supplement called pre-surgery. It is quite sweet tasting, just be aware. The only flavor they have is the strawberry. This is to help with anxiety pre and post surgery. It also affects our insulin levels pre and post surgery, which that can affect inflammation. It also can affect and help benefit the nausea that you might get after anesthesia. So it's really important to take this. You will get 2 bottles that you drink the night before surgery. The night before surgery, when you're going to bed, after that point, no longer can have any food solids. You can only have full liquids. And so this will be, or clear liquids, sorry, and this would be something you can have. And you will drink 2 of these within a 5-minute gap. So just chug, chug, chug. And then you will have those at the night of. 3 hours pre-surgery, you will drink your last bottle of supplementation. 3 hours prior to surgery. And you will again take it within 5 minutes. Like I said, it doesn't always taste the best, I apologize, but it does show some significant benefits for you during surgery and right post-surgery. So those will, if any questions or issues with tolerance, please reach out to me and we can go over that, and you will get those in the PASS Center. So next, it's really important that you don't just supplement, you also eat a healthy diet, and making sure you have half of your plate for breakfast, lunch, and dinner with vegetables. You have a quarter of your plate 100% whole grains. Those whole grains and those vegetables are gonna help you have regular bowel movements, and they help with inflammation. So post-surgery, a lot of individuals have complications with constipation, which we'll touch on, but making sure to have your fruits and vegetables will help with that. Then a quarter of your plate, palm of your hand, of protein. That can be your nuts, beans, eggs, and your chicken, fish, pork, and your dairy can all fit in that category. Making sure you have 25 to 30 grams of protein breakfast, lunch, and dinner. The supplementation that you get will not be a meal replacement. You will have that between meals. So make sure you don't replace your meals with that. Next is eating every 2 to 3 hours. Is important to getting all the calories and nutrients you need. So you have your meal, a snack, meal, snack, meal. Making sure pre-surgery you get them all prepared and packed, and it can be as simple as peanut butter on toast, crackers and cheese, tuna and crackers, fruit and nuts, but making sure there's a protein with a fruit, vegetable, or grain, and having those ready. And if you don't have someone there to take care of you, to bring those things to you, then get a whole bunch of them stacked up so that you can have them when you're having post-surgery. Things to keep in mind: that you are at risk for constipation post-surgery due to the pain medications and not moving as much. So really make sure you hydrate. That's one thing people don't really do as well because they're afraid to get up and go to the bathroom. So make sure you hydrate, focusing on clear pee. And keep up that eating to help things moving through. If you struggle, there's always prune juice, there's prunes. You can do a stool softener, but really just making sure to try to keep eating to keep those bowel movements going. That's it. And so if you have any questions, please reach out to me. My contact information is in that joint book that you have, or you can also reach out to Tina with any questions as well.
Hi there, my name is Carrie Sokol. I am the occupational therapist here at Mammoth Hospital. I wanted to talk to you a little bit about how to make your home safe for when you go home from your surgery. In occupational therapy, we look at self-care and home safety. So the first thing, most important, is be prepared. So before your surgery, you're going to want to look around your house. You're going to want to assess for any type of hazards. Picking up any rugs, any cords, any toys that may be laying around on the ground. We just want to prevent any type of tripping hazard. So that's the first thing you want to do. Another thing you might want to look into is having your pets taken care of. When you come home from the hospital, your pets are usually pretty excited to see you. And you just want to make sure they don't go near your surgical site, they don't jump on you, and that you're not at risk for tripping over them. So some people will have someone take care of their animals for a week or so just to be on the safe side, that they don't, cause a tripping hazard for you. Another good tip is to make some meals ahead of time. So prepare meals, and I know Casey has talked about dietary needs and nutrition, so being prepared ahead of time is really important. So you can prepare meals that are healthy and help you heal. The other thing is to arrange your kitchen in a fashion where you're not having to bend low or reach high to get your items. So in your refrigerator, you might want to put things on middle shelves so that you can reach them easily. Also, like dishes or glasses that you use a lot, have them within easy reach. Another tip would be, if you live alone, that you might want to have someone come in and help you for a week or two if you can. That way you just don't know the last minute things or what help you might need, so to make those arrangements ahead of time is suggested. And then also getting some night lights, putting some night lights around your house so that when you do have to get up and go to the bathroom in the middle of the night, you can see where you're going, and again, you're not at risk for tripping. So that's the most important thing. We don't want you tripping and falling and injuring that surgical site. So planning ahead is key. So the next section, I'm going to demonstrate some equipment that you might want to consider getting prior to your surgery. The first thing is a reacher. This is really handy to have so you can reach down and pick things up off the floor so you don't have to bend over. It's also helpful for when you want to get dressed. So you can use this to put pants on. You want to grab your pants with the reacher, and you always want to get your surgical leg in the pants first. So you're just going to put it down, and then you could just pull the pants up and then get your other leg in. Same thing for taking them off. The other device is a sock aid. So this helps put your socks on. So you take it like that, then you put your sock on it like that, kind of fling it down, slide your foot in, and pull, and your socks are on. Another handy piece of equipment is a long-handled shoe horn. So that, let me move my shoes over. So you just put the shoe horn in, slide your foot in, and push it down. That way you're not having to bend down and reach down to put it on. One final piece of equipment that might be beneficial for you to have is called a bedside commode or 3-in-1 commode. I'm going to grab that. So you will see this in your hospital room. So this allows you to have some handles to help you lower down and push up when you get off the toilet, on and off the toilet. And what you can do is take the bucket out from underneath and then place it right over your toilet at home. You could also use this in the shower if you needed, once you're cleared to shower. At first you're not going to be able to shower because of your dressing, but once you're cleared to shower, you could put this in your shower to sit on while you're showering. So that's called a 3-in-1 commode or bedside commode. Most of these items you could get at Rite Aid or Amazon, but we don't sell them here at the hospital. So insurances typically don't cover them, so it's an out-of-pocket expense. So that's it, and if you have any questions, don't hesitate to reach out and ask.
Once again, Tina, the RN from the PASS Center. I just wanted to let you know what you can expect to happen from here forward. We will have you come to the PASS department, which is our pre-anesthesia surgical services consult, approximately 2 to 3 weeks prior to surgery. At this appointment, we will take care of reviewing all of your medications, prescription and over the counter, so please either bring me a list or all of them in their bottles. You will also have an appointment for your bone density scan, and we will draw any labs as well as do any EKGs or chest x-rays that are needed when you're in this appointment. We try to make this a one-stop shop for you so you don't have to have extra appointments. You will also meet with our hospitalist who will review your health history, and he will be the one to give you your blessing for surgery. Once you have completed this, we will give you written instructions on which medications to take, which medications to stop, what to expect in the hospital when you're here for at least a night or two. We will give you all of your Ensure supplements that Casey mentioned. We will also give you written instructions on your showering prior to surgery, and the benzoyl peroxide and what to do with that. We will ensure that you have those prior to leaving our office that day. We will also get you set up for your physical therapy, and if you are a knee replacement patient, we will get you set up for your iovera appointment, which is the injections into the knee to help with pain control. Now, on the days before surgery, we would like for you to pack the clothes you're going to need. You will stay at least one night for sure, possibly two, depending on your pain and your mobility. Bring your phone, charger, your computer, your book, whatever you need to get through a night in the hospital in between sleeping and getting up with physical therapy. Every bed does have its own TV, so you do have that at your disposal as well. You don't need to bring any toiletries unless there's anything you specifically need, as the med-surg floor has all of the basic toiletries in-house. You'll get up with physical therapy right after surgery, as Ariel said, unless you're the last patient of the day, and then it'll be the next day. We will give you a call on the night before surgery, and we will remind you of which medications to take and which to stop. We would ask that you remove all of your jewelry and any piercings you may have and leave those at home. The nurse will give you a call with the time of your surgery, as well as the time you need to arrive at our admitting desk in the morning of surgery. We will also let you know that no food after midnight is consistent for every patient. However, everyone will be able to stop their clear liquids based on their surgical time. At that point, you would check in the next morning at our hospital. Please bring your crutches, your walker, if you're on a CPAP for sleep apnea, as well as any inhalers you use for asthma or respiratory issues. We would like for you to have those here in the hospital so that way it maintains your normal O2 and anything you do at home. So we would like those here with you. Once you have arrived, the nurse from the pre-op area will come and get you. They'll bring you back to the area. You'll talk to anesthesia as well as Dr. Karch and Britt one last time prior to surgery. After your surgery is over with, you will remain in the PACU for approximately an hour. We will ensure that you are not nauseous, your pain is controlled, and you're fully awake before transferring you to the med-surg room. Once in the med-surg room, you will be able to have a visitor. However, we highly discourage any visitors staying overnight. Okay, and just to have an idea of what to expect after surgery, you will come out with compression stockings on, known as TED hose. We'd like you to leave those on for at least 1 week after surgery. After that, you can remove them because you'll be more than mobile at that point. The primary purpose of those is to prevent blood clots, and in that first week, you may not be as mobile as you will be in the weeks following. We also would like that you would leave your Band-Aid on, which is also called a jump start dressing, because that has got antimicrobial bacterial properties, and we want that to stay on at least 21 days or whenever you follow up with Britt to remove your staples or your sutures. If at all possible, please do not handle the dressing. Please wash your hands if you must, and keep dogs and other animals away from it. Britt will see you in the office. She'll remove all your stitches and staples. At that point, you can discuss with either Britt, Dr. Karch, or physical therapy when you may resume activities such as driving, any recreational activities, and returning to work. We will let you know right now that it's approximately 3 to 6 weeks prior to post-surgery before you can drive if it's your right side, and it's 2 to 3 weeks post-surgery if it's your left leg. Okay, and I just do want to touch on infection prevention with this. We really want to emphasize just how much you need to quit smoking prior to surgery, because that inhibits blood flow to the area that needs to heal. We'd also like to ask in the 5 days prior to surgery, if you are a female, do not shave the area, as we don't want any ability to have an ingrown hair, a cut, or anything to allow bacteria or to get inside of it. We'd also like you to wash your hands at any time, especially if you are going to put on a cast cover to shower, if you're a knee patient, or if you're going to put your TED hose back on after taking them off for a day. Clean hands everywhere, because you really don't want to increase your time in the hospital or have to return to surgery due to any sort of infection. If, however, you do notice any drainage coming from the site, any redness or heat from the area, or you have a fever, please contact us as soon as possible, because we need to investigate the cause of these issues. And just to continue on with recovery at home, I just want to let you know that your energy is going to be really low for the first couple of weeks, so pace yourself in any activities you want to do. Try and bundle going to the bathroom with getting a glass of water with changing your clothes all kind of at once, so you can sit and rest. You'll want to, like I said, ice everything as best you can. It is your friend. Just make sure you have a barrier between your skin and the ice bag. We don't want any freezer burn going on near your skin. Also, you're going to want someone to be there for you for at least a week, if not 2, to help you out with these activities. Now, you will be tired. You'll need help getting to physical therapy. You'll need help carrying things if you're using a walker and/or crutches. Just as a reminder, we really focus on having a support system for you after surgery. because we do not want any falls in the home afterwards. We would like to make this as seamless as a process as possible for you with a great outcome. Thank you again for joining us. Thank you for watching our video. I hope this has been informative, and if you have any questions, you can contact all of us at the numbers provided. Thank you once again for choosing the Mammoth Hospital Orthopedic Institute for your joint replacement surgery.